As people are coming in, we're going to worship God together with this song, We Can Do It.
Marilah kita berjuang bersama untuk Malaysia. Susah senang kita bersama, kita anak Malaysia. Jangan berputus asa. 心里总是有许多彷徨与失措，
Thank you, Lord Jesus.
未来的日子该如何过？一幕幕消息不断漂浮在眼中，但这一切都无法掌控。虽然前路坎坷又难受，但有你和我一起坚守，我们一起期待更美的天空。马来西亚，我们能做到，虽然很害怕，坚持就有盼望。越是落沮丧，我们都一样，不分你我他，团结是力量。You can tell how tough our lives ahead. You have me and you to run the race. Miracles are gonna happen today. Malaysia, we are not alone. Love and hope are strong. Together we will go. With your voice and praise, fill our hearts with praise. We will never be the same. Love can change the world again. Malaysia, marilah kita berjuang bersama untuk Malaysia. Malaysia senang kita bersama, kita anak Malaysia. Jangan berputus asa. Malaysia, marilah kita berjuang bersama untuk Malaysia. Susah senang kita bersama, kita anak Malaysia. Kita anak Malaysia. Kita anak Malaysia. Kita anak Malaysia. Jangan berputus asa.
Amen. So, good morning, everyone, to our first webinar organized by New Life Shah Alam on the relevant topic of the day, which is today everyone is talking about vaccination. So, we have we're so glad to have a talk by our very own New Life member, Dr. Chong Chin Pin, or we just popularly known as CP, who will answer all your questions on vaccination. In fact, just last night, my wife and I were vaccinated with the AZ vaccine at the Shah Alam Ideal Convention Center. and the frontliners there really treated us like VIPs, and we even received complimentary dog gifts from Nestle. So it's a very wonderful experience, and they all made us feel like heroes because we are protecting not only ourselves but other people. Just a little bit about CP. CP is a registered pharmacist with solid experience in hospital and clinical settings. And so it's well qualified to present today's talk and to answer all the questions that you may have. CP has been trained in various disciplines with special interest in infectious disease and intensive care service, and is actively involved in bringing up the future generation of clinical pharmacists and mentoring future pharmacy leaders. And CP also lectures at the IMU today. So if you have any questions, just type in the chat box and CP will be glad to answer them during the Q&A session. So it is now my pleasure to invite CP to present to us this talk on Let's Talk Vaccination. All right, over to you, CP.
Okay, thank you very much, Pastor, for the kind introduction. I'll try my best to address all the queries or maybe your concern about the vaccine, but I will try my best. But I foresee there might be some of the questions that is not within my knowledge. But if that's the case, I will come back to you later. But I will try my best to answer all your queries. So just a bit about this topic. Of course, today I'm here. Thanks for the invitation. Because last time, as you remember, there was once that we gathered for online fellowship, because now everything have to be online. And we just talk about the vaccine itself and our experience, sharing our experience, like receiving the jab and etc. So then we sort of come out with this idea. Why don't we just have a session with all the church mates and talk about our experience with vaccination? All right. So, of course, in order to be qualified to talk about this topic, I myself must be vaccinated. So I received my vaccination back in April itself. So, yep, I'm fully vaccinated right now. So, only with that, I felt that, okay, maybe I'm qualified to talk about this topic, right? And I do experience the vaccine itself. So just a little bit on the vaccination program that we are having it right now in Malaysia. It is called the PIK in Bahasa Melayu, also known as a Program Imunisasi COVID-19 Kebangsaan. Right? So right now, this data, it was taken last night. Right now, we have 30 million individuals registered for the vaccine itself, and our vaccination rate for those who receive 2 doses, at least 1 dose, is standing at 2.8 million. So if let's say following the target, the KPI set by the government, we are still a bit behind the schedule because we aim to actually achieve 9.4 million of individual vaccination by this August, but now we are standing at 2.8. But the last that I checked, this is June. The last that I checked is during May itself, around early May. Within 1 month of period, the vaccination rate actually increased by 1.5 million. So if let's say we are keeping this rate, probably we will not achieve 9.4, but the government decided to speed up the program. So probably we might able to achieve the target, which is 80% of the population to receive the vaccine by end of this year or maybe early next year. Yeah. So 80% of our population. What does it mean? What and why 80%? So 80%, if we are looking into the Malaysia population, this is the estimation in 2020. The population in Malaysia is roughly around 32.7 million. And this is excluding, of course, those illegal immigrants and etc., those without record. And if we are looking into children below 18, the population is 9.24 million. So in other words, about 28% of the population is under 18 and they are not eligible for vaccination. So the remaining the remaining 72% of the population will have to do all the vaccination work. And with that, we are not even achieving the herd immunity or the target we want to achieve. But of course, I think in last month itself, there are quite a numbers of studies or maybe clinical research state that the vaccine itself is safe for children between 12 years old to 18 years old. So that is a good news. Means that probably in the near future, the Malaysia, we can start to vaccinate those who age 12 to 18. So that can actually cater to some of the percentage. And with that, hopefully, finger crossed, we can actually achieve 80% of the population with vaccination. That is the herd immunity. So in another word, everyone here today in this room, we need to get everyone here to be vaccinated in order to achieve this 80%. That also we have to exclude those who are not eligible for the vaccine. For example, some of them, they might be having babies, they are pregnant, they can't receive the vaccine immediately, or maybe they have some diseases that actually not allow them to take the vaccine itself. For example, they have a severe allergy reaction, history of severe allergy reaction, which require medical care. That itself, right, makes them unable to receive the vaccine. So that is some of the example. We have to account for that, right? So why herd immunity and what is herd immunity itself? Just a little bit of briefing so that we have a good context on it. So this is how herd immunity works, and this is a population with less than 80% of the population receive the vaccination itself. And the red color icon represent those who are infected with a COVID-19 virus. So let's say a population is not achieving 80% of a herd immunity. What happens is that they will start to spread the virus around, right? And what happens is that people in the middle, okay, of this community, those who are not vaccinated, for example, those who are under 18, they are at a risk of getting a vaccine, getting the infection itself. So what happened after that is that when there are more people getting infected with COVID-19, those who are vaccinated, they are also at risk, okay, at risk of getting a COVID-19 infection. Let's say, looking into another side of the picture, let's say we have more than 80% of the population receive the vaccine. So what happened is that with this, we are achieving the herd immunity. So when the virus spread, they spread to those who have not received the vaccination, and those who receive the 80% of the population, 80% of the vaccination, they can protect those who are not eligible for the vaccine. For example, children below 18, as well as some women who are maybe they are pregnant in their first trimester, they cannot receive their vaccine. So in that case, those who receive vaccine actually shielding them from getting the COVID-19 virus and the infection itself. So that is what we call the herd immunity. And for COVID-19, the target is to achieve more than 80% of the population. Again, with all the adults in Malaysia, we are only at 72%. And not to forget those who are not registered under the census, not registered with the government, for example, immigrants, illegal immigrants. So that we also have to account into the numbers. So it is very important to get everyone vaccinated by end of this year. So I will discuss some of the issues with COVID-19 vaccination by using a question and answer basis here. So I think that will actually help you to understand, because most of the time I receive questions from various parties and about the vaccine. And I think this will be the best way that we bring out the message on whether is it working or is it safe to be used. So first thing first, everything we take in, we must make sure that it is safe. Is the vaccination safe itself? Let's look into the numbers that the clinical studies or the research themselves, when they are studying about the vaccine, they are formulating it, they are actually making it to the vaccine and try to test in the field. we can have a look into the numbers of participants involved in each of the trial itself. For example, the Pfizer vaccine, where Malaysia will receive first, during the study itself, they actually utilized 43,000 of participants, and AstraZeneca at 24,000 participants. So these numbers, please slightly just remember this number. Pfizer at 43,000 and AstraZeneca at 24,000. Let's have a look on other medications that we are usually taking on our daily basis. Okay, for example, the hypertension medication that you are receiving today, I believe some of you are on antihypertensive medication for your blood pressure. Okay, so if we are looking into the study itself, for blood pressure medication, such an important medication that we use in so many of us, I believe most of us might have some hypertension and we are on medication. My mother is on this medication. During the study itself, they only utilized 8,000 of participants to test whether the medication is working or not. Okay, likewise, if you are looking into diabetic medication, most of the studies, right, they only utilize about 400 to 700 participants. So compared to the vaccine itself, where they actually utilize up to 40,000 of participants just to test whether the vaccine itself is safe and is effective or not, we can see that they actually put in a lot of resources to ensure that it is actually working and it is safe to be used. So compared to other medication, there are quite a lot of resources pumped into it to ensure that it is working. So with that number of participants in the research, right, we can actually say that it's quite safe to be used. Even when we compare to other medication, you can see the numbers are different in numbers. Right? So of course, every medications they come with a bit of a side effect. It is very common. And for vaccine itself, the most common, this is across the board, regardless you are receiving a Sinovac or AstraZeneca vaccine or maybe the Pfizer vaccine, the usual side effect that you will experience is a pain or maybe swelling or redness on the injection site, and maybe a bit of dizziness, a bit of muscle pain here and there, sometimes joint pain, and you feel tired. Some of you might experience fever. And for me, myself, because I received my Pfizer vaccine, actually, I experienced pain at my injection site, which is my left arm, and as well as a bit of tiredness. On my first dose itself, right, is on the first day, and the second day, I'm just like normal. But my second dose, the duration of the side effect actually prolonged to up until the days itself, but nothing more, nothing serious. Okay, just these are the common side effects. Sometimes some of the people, some of the recipient will experience diarrhea as well, but I seldom heard any of my friends actually experience diarrhea, although it is listed as one of the common side effects, but no, not such a case. Most of the time is headache, muscle pain, fever, as well as a tiredness. All right. So, but of course, everyone will be worried about the serious side effect. When the Pfizer vaccine, when it came out itself, everyone is worried about the allergy reaction. And when we try to introduce AstraZeneca vaccine, everyone is worried about the blood clot. So let's us dissect a bit on the data itself, whether is it safe or not to be used. So if we are looking into the severe allergy reaction, or in medical term, we call it anaphylaxis, all right? For the Pfizer vaccine, the anaphylaxis rate or the severe allergy reaction, we can see that it's 1 or 2 cases in 100,000 of people who receive the vaccination. And the reason of they develop this allergy reaction, right, it's not because of the main component of the vaccine, but it's actually some of the ingredient inside the vaccine itself, such as the polyethylene glycol, PEG, also known as PEG, which some of us might have an allergy reaction to it. And when we look into AstraZeneca, it's 1 in 115,000, okay, even more rare compared to the Pfizer vaccine. And because of the polysorbic 80, okay, it's not the main ingredient of the vaccine itself, but it's some of the excipient, some of the ingredient inside the vaccine that cause the allergy reaction. And so what happened is that when during the studies, right, during the research itself, that when they study about this vaccine, they found that most of the allergy reaction happen within 15 minutes of the injection. So from the point that they inject the vaccine until 15 minutes after it, these are the most common time that they actually experience the allergy reaction. So that is why nowadays, when you go into a vaccination center, for those who actually receive your first dose, or maybe for those who have not, you will always heard that you will be put under an observation bay for at least 15 minutes. All right. So that 15 minutes came from this allergy reaction within 15 minutes. So you will be observed for 15 minutes. And if you are okay after that, then they will release you for counseling session and to talk a bit on what you should be worried about your vaccine and your next schedule and etc. Then you can go home after that. But let's say, for example, if you have a history of allergy reaction, for example, allergy to maybe seafood or maybe allergy to some of the medications like some painkillers, then you will be put under observation for 30 minutes. Okay, another 15 minutes. So 30 minutes of observation before we release you. So this is to ensure that you will not experience any anaphylaxis, so that we can safely release you. Your safety is our priority, in fact. So that actually ensure that you will be okay. So if we are looking into the probability of a severe allergy reaction, which is the anaphylaxis itself, during the administration of the Pfizer vaccine, we can actually extract some of the data that actually provided from both the WHO as well as the drug manufacturer itself. So of the almost 10 million doses of vaccine administered in UK, they actually found that only 15 cases were determined to be the real severe allergy reaction. So if you are looking into the rate, it actually stands at 0.000005%, the chances of you getting a severe allergy reaction. So it's like 5 cases per million of doses. The likelihood of it is very low. It's even lower than lottery, even lower than 4D, even lower than Toto. So I would say, right, the chances of you getting a severe allergy reaction, very less likely. Yeah, very less likely. Okay, and of course, like I mentioned about 75% of the cases, right, occur within 15 minutes. That's why we will observe you for 15 minutes. You have to sit there, let us watch over you, ensure that you're all right, you are breathing okay, you don't have any breathing difficulties, you don't have any chest pain or anything, you're fine, then only we will release you home. So you are in a very safe hand. I believe that Pastor Joshua yesterday just went for the vaccination and he actually commented, "Oh, very tedious progress. I have to sit there for 15 minutes to be observed." Yes, we are taking it that seriously. All right, but let's compare it to other common food allergy. Okay, I think it's very good that if we compare to some of the common food allergy that we experience, and then you can actually visualize how safe is the vaccine in terms of allergy reaction. Let's take peanut. All right, a common food that we eat every day. I just had my peanut butter sandwich this morning. All right, so looking at peanut allergy in the Singapore studies, the prevalence means that chances of you getting a peanut allergy is actually standing at 0.3%. So which means that in 1,000 people that take peanut, there will be 3 people will have a peanut allergy. And out of this 0.3%, wanted to 50% of them, right, we actually have experienced anaphylaxis, where they will have a difficulty in breathing, their blood pressure will drop, and then they will suffocate and etc. That is way higher risk compared to the vaccine itself. So I would say, I think the vaccine is even safer than the peanut butter that we eat every day. So do not worry about the allergy reaction. But how about blood clot, which everyone is so worried, especially with AstraZeneca vaccine, that you can actually opt in. the chances of we getting a blood clot from AstraZeneca vaccine is 4 cases out of 1 million, which is standing at 0.0004% rate. You don't divide 4 this 1 million because of the way they calculate is not so direct, right? The chances is that low. But let's say if you are a smoker, I hope that you are not. If you are, come and look for me. I help you to quit smoking. All right. So it's standing at 0.18%. All right. That high. The chances of you getting a blood clot because you smoke, and the chances of you getting a blood clot from a COVID infection means that if you get infected with COVID-19 virus, and the chances of you develop a blood clot due to the infection itself is as high as 16.5%. And for those with a stage 4 or stage 5 of a COVID-19 infection, which is very severe, and you require a ventilator, you need to be intubated, you need to be admitted into ICU, your chances of getting a blood clot from COVID-19 infection is 30%. 30% means that out of 100 people who got admitted into ICU, 30 of them will get a blood clot. So that is relatively very low risk of getting a blood clot from AstraZeneca vaccine. So in fact, it is very safe. And if let's say if you are a older population above 25-year-old, the chances is even lower in the I will not say older, it's just slightly increase in age. So the side effect is more prominent in the younger population. So if you are above 25, the chances is even lower. So you should not worry about that. Sorry. Okay. Hello. How about breastfeeding or pregnancy? Actually, so far there are limited data on whether is it safe for pregnancy and breastfeeding. But the one that we actually have the data on it is actually the Pfizer vaccine and the Moderna vaccine. But Moderna, we are not importing it in Malaysia. So both of it, right? It is actually shows that the current recommendation actually shows that the Pfizer vaccine actually is suitable to be given for pregnant mothers between the 2nd trimester and 3rd trimester. But they are not giving the Pfizer vaccine during the 1st trimester, although there's no data says that it will be harmful. But we medical people, we are worried also. We try to be safe. So of course, we will try to actually play on the safe side. That's why we are giving out the Pfizer vaccine for those who are pregnant during their 2nd and 3rd trimester, not their 1st trimester. Good. All right. But how about Sinovac and AstraZeneca vaccine? So far, there's no data on it about the safety of Sinovac as well as AstraZeneca vaccine in a pregnant population. So because there's no data, when there is no data, we always want to play safe. That's why we are not recommending it to the pregnant mothers yet, right? Until there's a data released from the study says, oh, it is safe, then we will actually give them the AstraZeneca vaccine and the Sinovac vaccine in this population. So far, only Pfizer's we are using it for pregnant mothers. In fact, pregnancy itself is a risk factor for getting a COVID-19 infection, especially in the later trimester. So, of course, if possible, we will want to get them vaccinated. Okay, so how good is the vaccine? Here is another part. So now that we know that it is safe to be used, how good is the vaccine in protecting us? Okay, so this is a comparison between a different kind of vaccine from different country. The one that we are using right now is the Pfizer and AstraZeneca as well as Sinovac. If you are looking plainly on the efficacy, which is everyone is concerned about, you can see that Pfizer standing at 95%, and then AstraZeneca standing at 62 to 90, and Sinovac over 50%. All right, and people will wonder, is it means that Pfizer is better and Sinovac is not? I will explain it to you later. It is actually not the case. All right, but is that mean that standing at 95% of efficacy, does that mean that out of 100 people that get the vaccine, 95 of them will be safe and 5% of them will have COVID-19 infection? Actually, it is not. All right. The calculation is not straightforward, 95 over 100 and you get 95%. No. So what happened is that, how do they get to the efficacy rate is that they compare to those who receive vaccine, between those who receive the vaccine and those who have not received the vaccine, and they determine what are the risks of them getting the infection itself. So what happened is that they take 100,000 of the population who get the vaccine itself, and they compare with 100,000 of the people who have not been vaccinated, and they calculate and they observe how many of them actually get the infection. So during the studies itself, they found out that 50% from those who vaccinated 100,000, 50 people of them actually get the COVID-19, and versus the one that were not been vaccinated, 1,000 of them. And what happened is that they actually do a series of calculation. They take 50, divide by 1,000, and they get the risk, and then they 1 minus the risk, and you get 95%. So in fact, right, it actually, the 95% efficacy, it actually means that it reduces, okay, your risk of getting the COVID-19 by 95% compared to the unvaccinated person. So it's not a straight out like 95 people will be safe and 5 people will get the COVID. No, but it actually means that it reduces the risk by 95%. All right, it's a wonderful number of 95%. So does that mean that one vaccine is better than another? Just like what we see, the 95%, 90%, the Sinovac 50 only, really? No, actually it's not the case also. We don't compare apple with orange. Why do we mean that? If we are looking into the study itself, how they actually come up with the numbers itself, you can see that in the Pfizer vaccine, when they study it, they actually study in a population of 16 years old and above. Whereas the AstraZeneca, they study in 18 years old and above. All right. And when we look into the Pfizer vaccine, they start to observe whether a person get the COVID-19 or not after 7 days of the second dose. But if you look into AstraZeneca, it's after 14 days. But the time frame of both of studies also different. Whereas in Pfizer vaccine, right, they actually study in the US population, and in the earlier time where COVID-19 is not so severe yet and not much of the mutation happened. But if you are looking to AstraZeneca, they actually studied during the period of time where a lot of countries suffering from COVID-19, a lot of new cases and a lot of mutated cases. And the population they study is actually in United Kingdom, Brazil, and South Africa. All these 3 countries, right, they are suffering from a mutated strain of the COVID-19, not the usual one. And the mutated strain of COVID-19, they are known to be more infectious. They are known to cause a more severe infection. Means that you are more likely to get COVID-19 in that country. And if you get one, you are more likely to suffer for any complication or even death due to the COVID-19 itself in that country because of that strain. So under such circumstances, they are still able to achieve 90% of the efficacy rate. So we can't really compare Pfizer vaccine as directly compare Pfizer vaccine with AstraZeneca, because the setting that they do the studies, the population they do, the time frame they do, all of it is not the same. So you can't compare head to head like that. We can only compare it when we're doing both of the vaccine together at the same population during the same time frame in the same country. Then only in that case, we can say that, oh, okay, one is better than another. But are we achieving there yet? Are there any head-to-head comparison so far? No. Unfortunately, we do not have any head-to-head comparison, because you might wonder why we don't do it, because most of the resources we have right now, we are not sufficient to vaccinate everyone, especially after India has been hit with COVID-19 outbreak, and their vaccination manufacturing line has been affected as well. And we don't really have the resources. And now the resources are mainly focusing on getting the best way to administer the vaccine and the best schedule, the best method to vaccinate people, rather than comparing one to another. That is not the main focus now. We are not pumping resources into it. So any head-to-head comparison, unfortunately, so far there's none. All right. So I would conclude that whichever vaccine that makes available to you during the injection time is the best vaccine for you. Means that some of you might say, might ask, can I choose either AstraZeneca vaccine or Pfizer or Sinovac? I would say, as soon as you are able to be vaccinated, that would be the best vaccine for you, because that provides you the earliest protection for any COVID-19 infection, right? So then, because we bring up the topic of mutation, okay, and the mutated COVID-19 virus, does the vaccine works against the mutated strain? I think just by last week, we have been, the WHO actually released a new way to actually name the variants of the COVID-19 mutation. We used to call it by the country, like UK strain, Brazil strain, India strain, or maybe South Africa. But now we have a better way to call it. Okay, we call it by the alphabet, the Greek alphabet, alpha, beta, gamma, delta. We have a lot more, but we are not listing it here. But the one that we actually concerned right now is the UK, used to call the UK, the alpha, the beta, the gamma, as well as the delta. And in Malaysia, currently, we are having more and more cases of delta imported from India. All right. And it is known that this strain is more infectious, so be careful. And I heard recently that we got quite a number of cases in Labuan, another side of Malaysia. But recently, I heard that there are quite a number of Delta cases in Kuala Lumpur as well as Selangor as well. So everyone here, please be careful when you go out, all right? Try to minimize your movement. So is it working so far? This is data that I extracted in around, I think, early this year. So we can see that the current vaccine that we are having right now versus the alpha strain, it shows that similar effectiveness in preventing the COVID-19. But when we compare to South Africa as well as a Brazil strain, right? No data on Brazil strain. I think there's data available, but it's not in this table. But for South Africa, we know that all three kinds of vaccines that we are having right now, sorry, there's no Sinovac here, but for Pfizer and AstraZeneca, we know that it actually shows a lesser effectiveness in preventing South Africa strain of a COVID-19 virus. So it means that it does not work as good as the normal strain that we have. So far is that is the data that we are having. So does that mean that since it's not preventing the COVID-19 like 100%, and it shows that it does not prevent the mutated strain that well compared to other compared to the normal strain, should we actually not getting vaccinated? This is one of the questions that I received in the previous webinar. My point of view is, no, it's not my point of view. All of the healthcare professionals actually agree that despite that, you should get yourself vaccinated because there are few reasons behind it. Oh, sorry. First thing first, although it is not 100% preventing you from getting a COVID-19, but we also have to take note that none of the vaccine available today, so far, able to claim 100% efficacy rate. All right. You will wonder, actually our hepatitis B vaccine, actually the efficacy rate is about 70% to 80% around there, right? Some of the vaccine even have a lower prevention rate. I think like influenza about 50%. It means that actually standing at 95%, it is a very good result. Secondly, the COVID-19 vaccine does not just prevent you from getting a COVID-19. In case you are vaccinated and you get a COVID-19 infection, the data has been shown that those who are vaccinated, right, the severity of the disease itself, means that how bad is the infection, it actually shows that the data shows that you will get a less serious infection. Okay, for those who are vaccinated, you probably will have asymptomatic, you does not have any symptoms, or if you have any symptoms, it is less. It is more likely to be a mild one compared to those who are not vaccinated. So it means that they are also protecting you from getting a very severe infection. And thirdly, this is also very important, as we can see that now recently there are a few countries that are having outbreak, like India, recently Taiwan. The COVID-19 vaccine also try to prevent the spread. When we prevent the spread, means that we are reducing the chances of it getting mutated. All right. The more the virus is spread, the more likely it will be mutated. All right. Just like what happened in India. Okay, they have a very big outbreak, and that is what happened. They have a Delta strain right now. So looking into Malaysia, the infective rate is even higher than India right now. So I think the vaccine itself will probably help to prevent us from getting a mutated strain. So that is a very important point for getting vaccinated, right? So there are other questions regarding the vaccine itself. Some of it is the commonly asked question, and some of it is through the questions that I received during before this webinar. Let's address it one by one. I have 10 questions here actually. So first question: AstraZeneca vaccine cause bleeding disorder. It means that does the AstraZeneca vaccine make us easily bleeding, like nosebleed or something like that? Okay, so this is very interesting because not many people know about this. In fact, this is very rare. There are very small chances of the AstraZeneca vaccine causing a disorder called immune thrombocytopenic purpura. All right. So it basically means that there's some immune system disorder that cause you to have a low platelet count and have a chances to have bleeding. But most of the time, this ITP or most of the time they are very mild symptoms. So if you experience one, probably what we will get is some minor bruises, like a bit of otia here and there, and nothing serious. All right. And if let's say if it's getting more serious and you need a medical attention, do not worry, it is treatable and it's kind of like very easy to treat. So AstraZeneca vaccine causing bleeding disorder, less of a concern. All right, it's treatable and nothing more, nothing serious. All right, don't worry about it. Second question: does the side effect of vaccination varies according to different individual or different people? The answer is yes. So far, what we observe is that the younger recipient of the vaccine appear to have suffer more intense side effect. All right. And the elderly population, those above 60 or 75, the very elderly, when they got injected, they seems to suffer from maybe no side effect or even very light side effect only. So the explanation behind it is because the younger population, their immune system is stronger. So when they receive the vaccination itself, the body, they are very responsive to the vaccine. So when they receive the vaccination and the body start to react to it very rapidly because they are very strong body, so that they get an inflammation. And that's why their side effect is more intense compared to the older population. So actually, if you suffer from a bit of a side effect like sore arm or maybe a bit of fever, it actually means that the vaccine is working in your body. And it is a good news, right? Of course, you have a bit of a discomfort here and there, yeah, but there are ways to we can actually resolve. All right. The third question: is it advisable to receive a second jab of AstraZeneca vaccine within a shorter interval due to any personal reason? So far the data, okay. So far, what you have known is that the AstraZeneca vaccine, the minimum gap between first dose and second dose is actually 28 days, or maybe in another word, 4 weeks. All right, but in Malaysia, our second dose is scheduled after 3 months, okay, which is 12 weeks after. Why is it so, or why we are doing it in a longer duration? Actually, this is very good move because we are actually very up to date in terms of the latest studies. The reason why we schedule 3 months after the first dose is that there has been studies shows that for the AstraZeneca vaccine, if we are getting it by 3 months, it shows a better efficacy rate in defending against a COVID-19 infection. There have been a comparison between the shorter interval versus the 3 months interval. It shows that those with a shorter interval, right, they are likely to have infection, asymptomatic one, does not have any symptom, does not suffer from anything. There's no loss of senses, loss of smell or anything, loss of taste. They do not have any breathing difficulties, but they are infected. Compared to those who actually have a 3 months interval, they are better protected in terms of getting the COVID-19. So that's why now we are scheduling by 3 months. So if possible, we do not advise you reduce the interval of the vaccine between the first dose and second dose. I know, 3 months or 12 weeks is very long interval, but let's say if you really need it to be shortened due to any reason, I think it's best to discuss with the counselor during the first dose of vaccination and discuss with them whether is it possible to give for a shorter interval. For example, you need to go to overseas. The children need to go to overseas for studies and is scheduled in such a way that you need to receive it quicker. Then maybe you need to discuss with the counselor during that time. All right. So question number 4, recipient of COVID-19 vaccine should not take any type of anesthetics. All right, this one, let me read you the statement here. I have a very interesting statement. I received the exactly same message within my pharmacist group. What it tells in that message, it says that for those who receive a COVID-19 vaccine and they receive any anesthetics, means that anesthetics that make you feel numb and then go into sleep so that you can do operation or maybe a dental procedure or anything. It says that those who receive anesthetics, they are very dangerous and can cause death. Is it true? No. No data, no case report so far, nothing about it that anesthetics is dangerous to vaccine recipient. It is a myth. It's just something that on a WhatsApp and nothing proof about it. When I received this statement, I even go for a search for it to verify with a few practitioners, make sure that it is not true. Yes, in case there's no such thing, it's a myth. Someone just spread it on the internet, so do not believe it. All right, there's no such thing. 5th, should I take Panadol before, during, or after I receive my vaccine? All right, I know that a lot of you actually worry about the side effect, and some of you pre-treat yourself with Panadol before you receive the vaccine, or right after it, you actually take Panadol, but you yourself does not suffer for any side effect yet. All right. So the recommendation is actually we do not recommend you to take Panadol before or during the vaccination. The reason being, we do not want the Panadol to blunt the presentation of allergy reaction during our observation. Remember that you have to be observed for 15 to 30 minutes. We do not want the Panadol to blunt the reaction so that we can actually notice it immediately if you suffer from any allergy reaction. So we do not recommend you to take. But let's say after you receive the vaccination, you go home after the same day itself, or maybe a day after it, you suffer from a body ache, you have a fever, you have muscle pain, and you feel extremely uncomfortable and you cannot tolerate it. Yes, you can take Panadol, all right, to relieve from the side effect. Yes, in that case, yes, you can take it. But do not take Panadol if you do not suffer from any side effect, all right? So how about painkillers? Painkillers like your any like Akosia or anything. Okay, can I take painkillers before and after the vaccination? No, extremely not recommended. Cannot. All right, because the painkillers, right, it also have an effect of reduced inflammation, and inflammation is the exact thing that we want for the vaccination. It induces inflammation in your body so that your body can actually start to produce the antibody against the COVID-19. So if you are taking painkillers, which can reduce the inflammation, it will actually blunt the effect of your vaccine, and your vaccine will become less or not effective. So do not take painkillers. after your vaccination. All right. So another question number 7. I have hypertension, diabetes, high cholesterol, heart diseases, kidney failure, or maybe I have asthma, and etc. 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 Should I take the vaccine? This is a very common question that I receive from public. The answer is yes. Not only just a yes, but you should be prioritized to receive a COVID-19 vaccine. The reason is that if you have any chronic diseases, you are more likely to caught COVID-19 virus. And if you have an infection, you are more likely to suffer from a more severe one, and you are more likely to die from it. So yes, you are the priority group to receive the vaccine. All right, you are the priority group to receive the vaccine. In fact, we prioritize you to be vaccinated during the phase 2 of the program itself. So you should be actually, you should not be worried, and you should actually go for it. Okay, so the next question is that number 8. But how about if I have autoimmune disease? All right, like lupus, or maybe I'm currently on a high dose steroid for some issue, or maybe on immunosuppressant. All right, this is a bit complicated. Okay, we really need a further evaluation with a doctor before the schedule of vaccination. The reason being that if you are on any immunosuppressant that actually reduce your immune system or suppress your immune system, or maybe you receive a transplant before, like kidney transplant, or if you are on a steroid, that actually will impair your immune system. We are afraid that after you receive the vaccine, your body is not responsive enough to produce the antibody to protect you. So we need to actually sit down, discuss with your specialist to determine the best timing where your immune system is working very well. Then only during that time you receive your vaccination, so that your body produce sufficient of the antibody during the time. So that we really need to sit down and discuss. It's not yes or no answer. All right. So please discuss with your doctors so that you can actually schedule for your vaccination. All right. 9. I was infected with COVID-19 before. Does it mean that I developed natural antibody against it? And can I skip my vaccine? The fact is that yes, if you have been infected with COVID-19 before, your body do produce some of the natural antibody, but the natural antibody is not strong enough. The level is very low. It's not strong enough to protect you against COVID-19. So you still need to take the vaccine. All right, you still need to take the vaccine to protect you. In fact, there has been some data suggested that for those who have been infected with a COVID-19 before, when they get a reinfection, the infection can be more severe than the first one. So it is very important for you to be protected against COVID-19. Get yourself checked, right? And lastly, I have a food or medication allergy. Can I still get the vaccine? Yes, you can get the vaccine. In fact, my father, he's actually allergic to one of the painkiller. So he will be put when he received his vaccination, he was put under observation for 30 minutes instead of 15. So yes, if you have a medication allergy or food allergy, you're still able to receive the vaccination. Don't worry. But there are some exceptional cases. If you have any history of severe allergy after the vaccination, then unfortunately you are not eligible for the vaccine itself. All right, that is some exception that you need to take notes of. So let's say, for example, if you have been suffering from a severe allergy, required to be hospitalized and required to be on EpiPen, which is one of the medication to resolve you from allergy reaction. It's actually adrenaline injection. Yes, you might want to discuss with your doctor first before any vaccination. All right. I think that's all from my answering of Q&A that you posted so far. So we are still open for any questions. All right. Pastor Joshua?
Yeah, praise the Lord. Thank you, CP. It was really enlightening and very insightful talk on the COVID-19 vaccination. Yeah, I actually have attended about 4 or 5 webinars on COVID-19, but this is the best so far I've
Oh, really? Thank you.
It's very comprehensive and covers all angles, and it really appeases all our fears, and a lot of questions have been answered.
Carlos actually asked. Hi,
Okay.
Carlos, my cell group member.
Oh, okay.
All right. Should or can children below 18 be vaccinated? All right. Very good answer.
Yeah.
Very good question. Okay. By last month, we actually have data. We actually have research data published says that it can be children above 12 can be vaccinated. I think recently another says that children above 3 can be vaccinated, which is very good news. But so far, that is the publication. We are still not implementing it in Malaysia yet. So I think in a short while, we will be implementing it lah. So let's wait for the government for the move. All right. Also from my cell group member. Oh my god. All right. How many people advised to drink coconut water or 100 plus after vaccination, before or after vaccination to reduce the side effect? Is it true? Okay. It is a myth. All right. But no harm. Drink more water. Have enough rest after the vaccination and before the vaccination is very important. Is it really helping? There's no data or nothing says that it really helped. Okay, but I see it no harm doing it, but just that don't overdo it. All right, you can actually replenish sufficient fluids, water, no issue. But does it really help? Debatable lah. Okay, but just don't overdo it. All right, just don't like binge drinking or anything. All right, that's not. How did they get the Sinovac vaccination efficacy rate? Actually, it's the same method they actually do lah. The calculation itself, right? The calculation is very standard, like the efficacy rate. You compare those who receive COVID-19 vaccine versus those who does not, and compare the numbers of any of them actually infected with COVID-19 after the vaccination. All right, but I know that the Sinovac vaccine they actually done in countries that highly infested with COVID-19, South Africa included. So I wouldn't be surprised to see a 50% there, but it does not mean that it's not working. It is actually working, right? Okay, let's read. Ask on behalf of my husband. The person who has seafood allergy before vaccination, they will ask to fill out the information, right? Okay, yes. Before you go into the vaccination, during the vaccination process, there will be, I think, 6 stations. During the second station itself, if not mistaken, second station, you have a consent form. In the consent form, right, they will ask you about your medication history, medical history, or any allergy history. So during that time, you can actually mark it down. You have a history of allergy, and in the third station itself, you have a consultation with the doctor. During that time, you can inform the doctor that you have history of seafood allergy, all right? And they will determine whether what's your presentation of your allergy. Is it just a rashes? Do you have any itchiness? Or maybe you suffer from any shortness of breath during the allergy reaction. All this of information, and they will determine whether you should be observed for 15 minutes or 30 minutes. All right. So the doctors will be there to help you. Don't worry. All right. How thalassemia patients should aware on the vaccination? All right. Wait. Okay, for thalassemia patient, of course, thalassemia patient, they are actually at a higher risk of getting the infection. So, in fact, there's nothing to be worried of about thalassemia. You still can be vaccinated. Oh, that reminds me about another question. There's one question posted to me asking if I have issue with my heart. I have having some history of heart attack. My arteries has been blocked by a certain percentage. Should I still receive the AstraZeneca vaccine? The answer is yes, because the blockage in your heart artery, the ways that it happened, it actually is because of your cell the blood vessel wall, there's some blockage, and the mechanism of clot in the heart attack, as well as the mechanism of the blood clot in the vaccination is totally different. Okay, so it's not correlated to each other. So in fact, if you have a history of heart attack, or if you have a heart block issue, or any narrowing of your blood arteries in your heart, you are on a priority group to receive the vaccine itself, because you're at a higher risk of getting the infection. All right. So that's my answer for thalassemia, as well as for people with heart arteries blockage. Yes, you should receive the vaccine. There's nothing specific that you need to be worried. For thalassemia, I think one of the issues that you worry about is the bleeding, whether the needle injection itself can cause bleeding. Not to worry also, because the needle is very fine, so it will not cause much issue also, right? So about the injection site, it's okay, no worry. In fact, we are using one of the finest, very thin needles for COVID-19 vaccine, yeah, compared to the one that we use in the hospital for other medication. If we have access to Sinovac vaccine in China, can we bring it back? Is it legal? Actually, it is not. It is not legal at all. In fact, I would say this is called smuggling. Actually, it's not legal. Yeah. So no, do not do that. Okay. In fact, the one that I'm not so sure how do you get the access to it, but from what I know, because even for the vaccines like Pfizer or AstraZeneca, it is not like a finished product come to Malaysia and it can be distributed to be injected. No, not such a case. After they arrive to Malaysia, there are still some post processes. They need to reconstitute it, this and that. They have some steps to actually to do it before you can actually get the vaccination in the center. Even during the center itself, they have to actually mix it with water for injection and to the suitable concentration before they inject to you. So it's not just one-step things. There are quite steps in it. All right. Is it advisable to keep ourselves hydrated by drinking plenty of plain water after receiving vaccination? Just a normal drinking will do. All right. Do not need to be like over drinking. Okay. Yes. Hydration, get hydrated is always good, regardless of vaccination or not. So no issue about that. Okay, next question. I had AstraZeneca vaccine 7 weeks ago. What is it that I still having a strange feeling on my COVID arm when turning my arm to a certain angle? Is it due to injecting wrongly, poke, or is it permanent side effect? No, I don't think so, because the volume that we injected into your arm is a very low volume, okay, not even 1 ml. So it's 0. I think AstraZeneca is 0.5 ml. So it's very small amount compared to other injection that you receive. Is very small amount. I'm not so sure about the uncomfortable around your arms. Probably we would need to really assess it, like get a doctor to actually check on it. Sometimes it can be due to other reason, not because of the vaccine itself. So I think it's good to be assessed first before we say that it's the COVID-19 vaccine that caused it. Don't think so it's a permanent side effect. Nothing in such a case. The pain or the uneasiness or the sore arm for the COVID-19 vaccine, it is due to the inflammation, right? When you inject the fluid into your inject the vaccine into your arm, it causes some local inflammation inside your arm, in the muscle itself. So that actually caused the pain. But when the vaccine is distributed all around your bodies, right, the inflammation will actually be resolved. So I don't think so it's caused by the vaccine itself. Probably we will have to look into it, whether what's the cause. Unfortunately, right now I'm not with you, so I can't really ask further about your uneasiness around your arm. Yeah. So from Felicia, what are my thoughts about employers buying vaccine for their employees? Will this affect the national vaccination program, i.e. those who can afford get it first and probably slow down the process to reach the poorer or unemployed group? For this, right, I don't really have any comment on that yet because it's about the policy. But from what I know is that it is on a different process that to get the vaccine, so it shouldn't affect the national immunization program. It's quite a debatable topic, especially during the early phase of vaccination program, whether should we pay, should we enable ourselves to pay in order to get the vaccine. And during the discussion, a lot of professionals, healthcare professionals actually says that it shouldn't be that way, right? But in following case so far, as I know, it's only in Selangor that they can actually purchase the employer can purchase it through the Sri Lanka. So in my opinion, actually, I don't think so. It's gonna affect the national immunization program, because this is Sinovac. But for the national immunization program, we have 3 different kinds of vaccine, which is the Pfizer, the AstraZeneca, as well as the Sinovac. So I don't think so. It's gonna be impactful to the poorer or unemployed group, right? They are still able to get their vaccines through the national immunization program. Okay. From another one, if I have diagnosed with sepsis and cancer before, is it okay to take AstraZeneca vaccine? Yes. In fact, you should get your vaccine as soon as possible. All right. Cancer itself can cause some immune impairment. All right. And sepsis itself, right, kind of quite a long complications that you get from sepsis itself, right? The complication of a sepsis is quite a lot and can last for quite some time, and you are at risk of getting infection. Your body immune system is weaker, so you should get yourself injected. AstraZeneca vaccine, Pfizer vaccine, or Sinovac, either of it will do. All right. Sudden death due to heart attack after 3 days of vaccination. Why? All right, interesting question. Okay. I think we have been receiving a lot of reports on social media or maybe on the newspaper says that certain people actually pass away due to after the COVID-19 vaccine. Is it true that it caused a heart attack? So far we have been treating. From what I know, the KK have been treating all these side effects seriously. Whenever there's a mortality or maybe a mortality or case of death after the vaccination itself, we will perform autopsy, all right, to actually check what is the cause of the death itself. So there are a lot of vaccine recipient, right? They have a pre-existing chronic diseases that they are actually at any time they will actually develop the complications and which leads to death. So I remember this case, right? The autopsy says that it is not related to the COVID-19 vaccine at all. So I don't think so. I don't think so. It's a concern here because the autopsy shows that it's not related. In fact, there are quite a numbers of death after vaccination. It has been proven nothing to do with the COVID-19. In fact, among the healthcare professionals, we even joke about it. You get the vaccination from the vaccination center, you get the vaccinator, you walk up from the street, you're ready to go home, and you got banged by a car and you died. And the newspaper will come out. Youngsters die after COVID-19 vaccination. We even joke about that. Because a lot of the time, right, when what we observe in the social media or even on online news portal, right, we can see that title, it claims that how many deaths after the vaccination. But when we read into the articles, or at the very last line, right, it will say.
我这个不有一下子嘛，有时候我3個4嘛，3個4唔得。Next time you also don't use a handphone.
Okay. All right. So. Okay. Sorry. In fact, right, if you read into the articles, at the very last line.
Please unmute yourself. CP, please unmute yourself. CP, unmute yourself.
All right. Okay, I'm back.
Yeah, okay.
So in fact, right, the newspaper, the news, right, on the thick title, it says that someone actually died after the COVID-19 vaccine. But at the very last line, right, it actually says that it has nothing to do with the vaccine. So it's a clickbait lah. So be careful. Whenever you see such a title, right, you click into it and you read properly what they actually wrote. All right. And also be aware of the autopsy report that released by the government. Because any case that any cause of death caused by the vaccine, right, we actually treated it seriously. Before you worry about it, we will worry about it first, because we ourselves also received the vaccine. So if that is true, definitely it will be a big hoo-ha among us. But so far, there's none of it. So nothing about that. Yeah. So I hope that it resolved your concerns. Okay, next one. For those who have COVID Sinovac vaccine, can they vaccinate another brand like Pfizer or Allergy in the future in order to get another?
Nice.
Okay. It's a political question, but I answer you scientifically. So far, we do not have any data to support that it is working very well if you receive vaccine A in the first dose and receive vaccine B in the second dose. All right. There is a clinical trial ongoing right now to determine whether is it working in such a case, be it AstraZeneca, Pfizer, or Sinovac, either of it. All right. There's no data to say that it works well so far. We are still waiting for the result. All right. And for now, we do not recommend such a move. So it's my scientific answer for your political question. So we do not recommend to do it. One of the reasons is that the vaccine dose, right, is actually paired up when you register yourself for the vaccine, right? If you register for AstraZeneca for the first dose, then automatically we will actually allocate AstraZeneca for the second dose. Let's say under any circumstances, you yourself opt for other vaccine, you yourself get another source. So what happened to the second dose of the AstraZeneca vaccine? Are there anyone's going to take up your second dose of AstraZeneca vaccine? No. But in that way, you are actually wasting one dose. So there will be one less people who eligible to receive the vaccine but couldn't get the vaccine because of such a move. So we do not advisable for mix and match like that. So far, there's no such program in government setting as well, unless you suffer from serious side effect from the first dose. Then the second dose, we probably will opt for a different kind of vaccine. For example, if you receive Pfizer vaccine in the first dose and you experience a very severe allergy reaction, for example, then the second dose, we will not give you the Pfizer anymore. All right, that will be the one of the case that you will receive different kind of vaccine. But if you are healthy adults without any issue, we do not recommend that. Right? Skin rashes on the 9th day after taking my first dose of Pfizer. Why? Okay, for any side effect of just wonder, is it the first dose or is it the second dose of Pfizer vaccine? I'm quite curious. If you do not mind, can you type it down there? But 9 days, even for the either first dose or second dose, I think it's less likely the skin rashes can be due to other reason, not necessary for the vaccine, because from what we know, the side effect of skin rashes or maybe allergy reaction of Pfizer, it usually happens within 15 minutes. And if let's say any skin rashes, right, the usual time it happens is about 2 to 3 days, right? And it can drag on, the side effect can drag on and usually resolve by 7 days. And if it developed on the 9th day itself, right, I'm a bit doubtful that the vaccine that caused the rashes, it can be due to any other reason, maybe the food that you take or maybe the bed sheet or anything, right? So I just wonder, is your skin rashes resolved already? I hope it is, okay? And hopefully it's not a severe one. But I don't think so it is related, based on the timeline, I don't think so it is related to the vaccine itself, because it usually happens around the 2nd to 3rd days and it will resolve by the 7 days, right? So hopefully you feel more confident about it, okay? Connie, any mental side effect to a dementia patient after taking Sinovac? Not that I'm aware of, Connie. So not an issue, all right? In fact, people with dementia, they are at a higher risk also, okay, of getting the infection. So I don't see any issue about that. 21-year-old male giving first dose of Sinovac, but no side effect at all. Does that mean that the vaccine is not effective? I don't think so. Not everyone will experience a side effect. Like me, myself, I experienced very, very mild side effect. So just a bit of sore arm. Yeah. So I don't think so it is I don't think so it is not effective. Okay. But how do we determine it? There's another way that we can get the antibody tested, but it's a tedious process. We don't really do it for monitoring purpose. Okay. They are actually in the very beginning of the COVID-19 vaccination program, there are actually a few studies actually after they get vaccinated, then we actually draw their blood and test the antibodies level. Yeah, there's such a way, but I'm not so sure whether it's commercially available or not, if you're really interested to know. But I don't think so. No side effect does not mean that it is not effective. So I don't agree with that. So should not worry about that. Let's see what happened with second dose. Hopefully it's nothing. All right. Okay. Since the vaccination is positive, why can't we make it compulsory? Would they speed up the journey towards the herd immunity? Okay, thank you, Carlos, for the question. This is a tough question. We have been discussed about that, whether this is a bit on policy making. I don't think so I'm the right person to answer any question about policy, because I'm not a policy maker. Can we make it compulsory? Just like what happened in Malaysia, right? I will give you some of the things, some of the facts that happened in Malaysia. For children, all the children in Malaysia, they should receive vaccination for various kind of infectious disease, like tuberculosis, measles, mumps, rubella, and etc. And recently, a pneumococcal vaccines. Do we penalize the parents who don't bring their children for vaccines? So far, there's not a big hoo-ha yet, but we not really any court case before. Not that I'm aware of about that. So for the pre-existing vaccination program, we are not really like enforcing it well. I'm not so sure about whether can we do it for the COVID-19 vaccine. Yeah, we even talked about whether should we find those who actually refuse or reject the vaccine. Yeah. So sorry, Carlos, I can't answer you this question. Yeah. Next question. After getting Pfizer, one of your auntie got shingles. Is it common to Pfizer? No, not that I know of. All right. Not that I know of. Okay. Yeah, maybe we need to ask Kyrie. I think even Kyrie also will have Kyrie Jamaruni will have a difficult time to answer you. Definitely someone asked him before, but he tai chi it away. Okay, I hope that actually answered everyone's query. Yeah, we definitely overshoot the time, so I hope that it is okay, right, Pastor?
Oh, no problem, no problem. Yeah, I think it's good because it shows that people are really, really keen and very interested. I got one last question, CP. What
Okay.
about people who are very kiasu and they take the AZ, then they take the Sinovac, then they take the Pfizer, one after another to protect themselves even more. Is that harmful or is it possible to do that?
So far, this topic, right? I mean, this idea is not new. Whether like can we like double dose the vaccine itself? Unfortunately, don't really have data. I mean, it's the same question like just now. Why can't we just do a head-to-head comparison between a different kind of vaccine? Unfortunately, we do not have the resources to do that kind of study right now. Yeah, like imagine I myself in the current situation, right? For this, at least for this 1 year, I would not encourage to do so. The reason is very simple. If you take one additional dose of vaccine, you are taking it the chance of another person to be vaccinated. So you are being very selfish and you are getting other people not protected. Okay?
Yeah, true.
By right, another person can be vaccinated, but you took away the opportunity by getting another vaccines, right? So I do not agree with that.
Yeah.
Right? At least for the current time being, no data to support and being a very selfish move. I do not recommend it.
Yeah.
All right.
Very good answer. Yeah. Okay, so you can all unmute yourself and give a big thank you to CP. Thank you very much, CP.
Thank you, CP.
Thank you.
Thank you.
Yeah.
Thank you.
Thank you. Bye-bye.
Well done.
All right. Okay.
Invite you,
Bye.